Thank you, ma'am. Now I would like to welcome Takshashila ma'am for her presentation.
Yes, thank you so much. I am Dr. Imanu Takshila Vignanage. I am Professor of Practice, Department of Yoga and Consciousness, Andhra University, and I am a coordinator for Pali and Buddhist Studies to Sri Jawaharlal University, Sri Lanka. So I am originally Sri Lankan, working in India. So today my presentation is integrative patient management, the role of yoga and meditation in CABG patient recovery, a clinical study on the heart yoga protocol. So this is 3 years work. 3 years work within 10 minutes. It is not possible to present each and every slide to explain. I will briefly explain and I will show the pictures and the procedure when I am presenting. Okay, this yoga protocol I created for the CABG patients. May I know how many people are there know about yoga? Yes, she's expert. Yes, 2, 3, and 4. Thank you. 5. Thank you. And how many participants know about CABG? Okay, I have to explain both the topic. CABG is coronary artery bypass grafting. I think now everybody know bypass grafting. So coronary artery bypass grafting means, first I will show the picture about coronary artery and what is the bypass grafting. Coronary artery in our heart, artery, the artery, what is the purpose of this artery? Through this artery, our heart muscles get the oxygen and nutrition. So what happened? The fatty matter, because plaque deposit in this artery and blockage this heart muscle. So what happened? Because of less blood circulation and the nutrition less blood circulation, the heart muscle is getting weak, and because of this issue, the people are getting heart attack and they are going to die. So CABG patients mean they already experienced death. So what is the new, that means allopathic way? They are using bypass grafting. That means they are taking good artery. Sorry, I am sorry, it is not good. Next. Okay. This is the good artery, good heart, and the other one is the already damaged heart. I think you can see what is the difference between good and bad arteries in the heart. And this type of heart, what happened? The people are going to die. They are getting heart attack. So what is the allopathic doctors are doing? They are using the bypass grafting. Bypass grafting means they are taking good artery in the leg or arm or chest. They are taking this, removing this blockage part and grafting with this new artery. So this is the bypass grafting. Then I think you can understand what is the situation of this patient who has completed CABG surgery. So most surgeries we are doing with the open heart surgery. So open heart surgery, after people has the wound and they are stressed so much, they experience depression. So this type of patient can't manage easily. So manage these people in allopathic way, they have different protocol. So my protocol I applied is name as heart yoga protocol. Applied for this patient, 400% I use case and control.
Excuse me, don't be chatting please. Please cooperate with the speaker. Thank you.
Thank you, sir. Case and control, I divide the group to case and control, and this case group I apply this heart yoga protocol, and the other group I didn't apply anything, they used only the medication. That means allopathic medication. So after that, I use this is the methodology, case and control. This one, 3 years work. I work with each patient 6 months, supported with the Apollo Hospitals Visakhapatnam. I got the data, clinical data, everything from the Apollo Hospitals. The cardiac department of the Apollo Hospital, they given the patients with the consent. I have institution approval and the Apollo Hospital Ethical Committee approval. So after that, I analyze the data. My data I will present in the letter. Before I will say what is my protocol. I am dividing this my protocol into four phases. So this 4 phase. First phase I used this CABD first phase. After surgery, first days to 7 days. My goal was monitor heart function and prevent complication. Second one, start gentle movement to prevent blood clots. Manage pain and wound care. The most part works because in the hospital I can't do so many things. Monitoring part complete done by the hospital, but I want to give some exercises for them with their consent or their family consent. Only we giving some sukshma vyayama, pranayama, breathing techniques, and so mainly that anuloma viloma pranayama. That is, I think, very familiar who knows yoga, and that breathing technique. But what is the benefit of this breathing technique? Our nadis mean our nadis are like pulse, not the pulse, but these nadis are taking all the chemicals running through our body and balancing parasympathetic, sympathetic nerve system. Parasympathetic nerve system is always what he is doing. Sympathetic nerve system is always getting generating stress. Now also my sympathetic nerve system is working. So because generating stress, good stress is good for good time, but over stress is getting harm to our whole body because of that hormones is dominating our blood circulation. So the parasympathetic nerve system is balancing or reducing this all the activities in body. We can call like it is fight and flight activity. Adrenal gland is dominating for that time. So however, with this pranayama, especially anuloma viloma pranayama, we can manage sympathetic and parasympathetic blood nerve system. Anyone has stress. I think this is the common word everyone these days say. I have so much stress. I have so much anxiety. I have always feeling insomnia. I can't sleep. So because of this type of issue, we can remove through this type of pranayama and some sukshma vyayama. These both are very, very helpful. So this state of the patient, they can't sleep, they are already faced the death, and their body pains, most of the surgery pains, and they emotionally unbalanced. So balancing this state, I use this protocol first phase. For second phase is with the food. I have to manage with the food. You can see after they came, this is 1 to 6 weeks. They already came to home, and the food also recommended some healthy food, less fat, less salt, and the food are good with the good quality and simple digestive food. And some asanas in my protocol I given sukshma vyayam. Sukshma vyayam, if you want, I can practice now also. Just stretchings, whole the body stretchings. But what is the difference between this stretchings, general stretching, and yoga stretching? Yoga stretching, we always breathing. When we move the hand, we can move hand. But yoga, we are saying you move the hand up, inhale, exhale. with the breath only. It's not like just movement. So this way we are practicing leg movements, whole body, activating with the stretch. And the sitting asanas and the pranayama. Pranayama means this breathing techniques. All this practice, finally we are giving yoga nidra. Yoga nidra is relaxation, body and mind together. Anyone can practice to reduce the stress. This is good. This, especially this type of patient, they are practicing this type of asana and pranayama. Their healing, their recovery process is fast. So this is second phase. And third phase, this is a practice done by my participants, my patients from the after surgery. And third phase, they can do stand asanas. This is 12 weeks, nearly 3 months. So this is, they are very energetic. In this time, I can see, compared to case and control group, case group, they are very energetic, they are enthusiastic, they want to show more strength. And I recommend some food. This is, you know, everybody know in India, it is called Shankapushpi. And this blue pea flower tea, that is the best tea for anyone for reducing stress. So in Thailand, it is very popular, blue pea tea, blue pea drinks. So this drink and this is rice made with the blue pea. So this food and the yoga and the breathing techniques help them to fast recovery. This is the third phase. And fourth phase, okay, this is they are practicing. And this is fourth phase. Now beyond the 3 months, if they can do any asana and they can do meditation also without any chair support. So they are practicing meditation with their support. This is the protocol I done with them, and this is when I conducting relaxation session where we are giving another treatment for the who has high BP. They have high BP means very difficult to reduce with medicine. Every time 140, sometimes this practice. But giving this mud therapy, we call naturopathy mud therapy, within 45 minutes, their blood pressure will be getting down. So this is the best one. Anyone has high BP, but not just applying this. We have to give the relaxation with yoga nidra with this mud pack. So I collected their data, biochemical data, as well as stress. That means this is my parameters: systolic blood pressure, diastolic blood pressure, pulse, LDL, HDL, triglyceride, BMI, and fasting blood sugar. This is the final results, final evidence from that. After 6 months, each patient, 200 patients, 151. I have to tell what is the SBP in systolic blood pressure. 120 is the normal level. So when I started, their BP was 151 to 52 plus or minus 11.86. But after this 6-month practice, my final, this is means, after the calculation, standard deviation is 119 plus or minus 0.8. You can see how the difference. And same, I checked with the control group, see how it is. They also start in 151 and finally 139. This is 139 is the generally any after surgery you can check anyone has done any heart surgery, their blood pressure not going down like this. But who are practice HYP protocol, their blood pressure become normal. Then doctors reduce medicine. Some patient completely doctors stop. I didn't stop. I can't. I am not the allopathic doctor. I didn't stop. So the doctors advised to stop the medicine also. So that much results they got after use that heart yoga protocol. So I want to introduce the yoga, meditation and naturopathy for the fast recovery for the heart patient. That is my research work. So this is another gender basis I analyzed. You can see starting ladies have less blood pressure compared to male. When starting, I don't know the reason. So, however, the practicing after.
Because all the pressure is giving to the men and relaxing.
Yeah, this is India.
Tension to men.
Yeah.
So this is in India and Visakhapatnam. That is my research limitation. I done only the Visakhapatnam patient, but some patients not only from the Visakhapatnam. Apollo Hospital is the widely spread hospital. So many people coming from Orissa also there. So this is the findings. I think number wise I explained. This is control group. It is not much different case and control because they did not practice this protocol. But some reduction is there compared to previous and after. What is the reason? They also used medicine. Using medicine also people are recovering. Otherwise, how worldwide people are recovering? So they are recovering. But compared to the who practice HYP protocol, they are recovering fast. So this is the I want to prove with my research work, and anxiety and stress level also analyzed with the HYP psychoanalysis test. I create this questionnaire. I got very good results. This is also female and male. Always female in less compared to the male, and reduction of the stress level, anxiety level is both similar, but the stress level is different. Our ladies less, and men's are more. Insomnia is different. Ladies has more insomnia compared to the men. So this is my findings. So thank you very much. This is a hospital, and the final my suggestion, future direction is this type of thing is that this naturopathy technique, yoga and meditation is there. No need to use the harmful medicine. So if we can introduce this type of protocol with the AI, I am suggesting here anyone good for the AI, please collaborate with me, and we will do AI tool for the free for any CABG patient to use after their surgery. So thank you very much. Any question is there?
Is that?
Is that? Okay, thank you so much.
Just a minute. Your presentation was very nice. Contents was also very nice. My question is there any yoga or the sukshma vayama for reducing the belly fat and the fat?
Sir, no, yogas are not for the completely body. Yogasanas are there. I started age 40 my yoga practice. I start my yoga study age 40. Now I am completed 11 years, but before I started like young time, I know it is a little bit different. But starting young time yoga, because my daughter and son, both our practice started in age 9, 10. So we can manage this type of people's body easily. But if you manage your body with this yoga and meditation, chakra meditation is the best, but it is easy to practice. Is it not easy to practice? So other sukshma vyayama also, we can manage any disease without any medicine.
With the kind permission of Dr. Prakash sir, 2 or 3 years back we met here only. Takshashila was, I think Takshashila was thin and slim one. Now day by day she is also improving her. So you are not doing anything for yourself.
No sir, I am not physically unworking.
Okay, but
because my age is now it's not possible to work that much. But I am practicing meditation and in psychology part. Still in my age, I am in the above 50. But I am not. I didn't get any blood pressure issue, any diabetic issue.
That is.
Yes, and I have flexibility to do anything. But my heredity is not giving that option. And so that is the reason.
Yeah, healthy mind is most important.
Healthy body is important than body.
It is possible for a person who the age over 60 years practicing yoga. It is powerful.
Yes, yes, sir. Because every asana is not so for the everyone. That is mentioned in all the Hatha Yoga texts. Asana is coming from Hatha Yoga texts. Hatha Yoga means the classical texts, Garendra Samhita, Hatha Yoga Pradipika, Hatha Ratnavali, some classical texts are there. These all texts are explaining what is the asana, who are the person good for the asanas. So some asanas like Sheshasana and
Sheshasana is not good for 60
yes,
above.
not 60. Some ladies also not recommending Sheshasana, but who are practicing young time, they can do any asanas. But some asanas, according to the body, according to the person's flexibility and the practice period, only we are recommending. About 60 people, we can say Krishnamohan sir, I know him personally, he can do some good asanas.
He is not above 60. He is 40.
Already 60 or above. It's possible for them to practice yoga
Yes,
from the beginning.
Definitely, sir.
From the
You
beginning.
have to start in a
Yeah,
small
you
way,
can start.
gradually in a year. Definitely
Yes, you can do.
Because the body can be flexible.
Flexible is coming, sir, with continuous practice. The yoga is not just 1 or 2 days. We have to practice with a progressive way. We can go like progressive way. And you can see that heart patient after done CABG, that means yes, CABG means open heart surgery. That people
It's also cure heart disease
yes, fast
and high
recovery.
blood pressure.
Yes,
Cure.
yes, yes.
Even at the age of 60, you can start with Sukshma Yoga. You know, there are different variants.
And people like you, if you practice yoga, you also look younger than the real age.
Yes.
See, if you are practicing yoga, not practicing yoga, if you have a money problem, you will have mental pressure. If you have a family partner problem, you will have mental pressure. So how can we avoid these things
Yes.
in the life? So that tension always will come. If everything is okay, the kids are having some issues. Maybe they're related to their studies, related to their affair or whatever maybe. So it will come to the parents again, and we are tend to go for the tensions.
So this tension we can remove through the meditation practice, relaxation and meditation. But main issue,
When the person is in a tension,
yes.
they are not able to do any meditation.
No,
Because
sir,
I
no,
also
sir. No, sir. That is the guide. Who is the
I will take a
guide?
switch off your mind.
That is the no, sir. I will give the answer for that. The guide who are teaching to you first identify your issue. Then only according to your, that is the importance of your guide or teacher or guru. In we are called guru. According to their guide, their findings, only they are giving guidance. Directly you sit and meditate, it is more stress than everything. So no.
Clinical
Yeah.
psychologists are also there.
Yes, it is, the time is over. It has
okay.
5-step method. If you give any chance, I will give to everyone meditation without any stress. Thank you so much.
Thank you, ma'am.